So from the part 1 video we saw that Aconite needs light. Light is from where you get energy, positive energy. Okay, where you feel that rest assured, anything happens, she's there or he's there. So HHF was the light for us and Asha was the light for us and is today. From where we got that positive energy, from where we got a direction, from where the darkness of our science was removed, and from where we got confidence that yes, we can do it. Okay, and so this is what Aconite wants. So Rao sir, when I met him for the first time, he I did not know, but there was some feeling that he's the one who's going to be the trend setter for me. He's the one who's going to be the path breaker for me, and he's the one from whom I will seek that light for what I have been craving for. Okay, and so he taught me what Aconite is, what belladonna is, something which I just routinely learnt all through my college years. Okay, just for writing in the exam I used to mug up. Okay, so but then when I saw him prescribing Aconite for the first time, it was for a patient who was having some problem. Okay, and he, whenever he would have any problem, he would just come to his clinic, and he would have those anxieties, those chest pains, and he would just want that sir to, so sir would do what, he would just talk to him softly, ask him to lie down and give him a dose, and like, just wait, relax, don't go anywhere, just be here. So for half an hour he would lie down, for half an hour he would just sit in his waiting area, and he would be fine. Okay, so Aconite को तकलीफ में, if he is in problem, you have to talk to him properly in the sense you have to be soft to him, you can't be hard to him. Okay, or can't be if you are in a hurried tone, if your tone is hurried, then Aconite will feel very vulnerable. He will like, whether I'm in his safe hands or not, whether the things will work out for me in a good way or not. So if the doctor is soothing, or the सामने वाला person is soft, then they get that assurance and they have that hope that I'll be fine. Okay, and जहाँ से wherever, if so he will go in the state of hopefulness from here, from getting that light, and after he goes back, okay, and if he comes across any other issue, then again he will go in that despair that no, oh no, what will happen. So it would happen in it happens in skin cases also, where till the time they are taking medicines, or in any case for that matter, that till the time they are taking medicines, they feel that confidence is there, and they feel everything will be fine, and whatever problem happens, my medicines are going on. But then the moment medicines are over, or suppose the doctor is gone somewhere, okay, then they will go into that despair that oh no, I won't be treated now, something's going to happen, and my life is in danger. Okay, delusion, doomed being comes when that light is not seeked, the light is not available. Okay, it is not handy, the person is not there, or the situations are from where they feel vulnerable, they feel that now something will happen and I can't handle it. Okay, they can't handle it, they want somebody else to do it for them, so they will go in that despair. So hopeful alternating with despair, till the time medicines are going on, I feel that it will be fine, my disease will be cured, but as soon as the medicine get over, I feel that now it won't be cured and nothing can work out. So the moment again doctor tells him in that despair only, no, nothing will happen, don't worry, just a matter of few days more, you continue the medicines. So then again they will go into perseverance. So perseverance is what? Perseverance is not just continuing medicines, but continuing medicines, or continuing to put efforts in spite of facing failures, in spite of a downfall, in spite of that the child is not recovering and the mother is Aconite. Even if the child is not recovering, but if the doctor says that don't worry, it's just matter of few days more, or just I'll just give a good medicine tomorrow, by tomorrow your child will be fine. So then tomorrow the child is not fine, or the problem recurs, then like, oh doctor, again, so then the doctor says, okay, don't worry, in 24 hours we will take care of your child's health. So then again she will go into light, like, okay, fine. So anxiety followed by indifference, hopeful alternating with despair, this is how Aconite lives or leads his life. So based on the intake of light or the availability of light, this state keeps changing. Okay, so and perseverances in spite of repeated failures. It's okay, the doctor's medicines are not working now, it will work tomorrow. The doctor has told that she will do it, so I will continue here only. So again, if the medicine is not working, again she will ask, the doctor gives assurance, she will continue, she will not change the doctor. Okay, so this is how Aconite drives. Then there is one rubric, delusion. Mental acts are performed in stomach. Mental acts are what? Mental acts are thoughts of calculation, thoughts of intelligence, all that is performed in stomach. What decisions I have to take, the judgment, okay, all that is performed in stomach. Stomach meaning what? Stomach is the seat of anxiety. Stomach is the seat of fear. When a child has fear in pain in stomach, okay, बोलते हैं ना कि there was a child who used to have that repeated pain in abdomen, in stomach, whenever he had to go to school. Okay, in the morning mother would wake up and he's like, Mama, मेरा पेट दुख रहा है, नहीं जाना है, नहीं जाना. And then when you ask that, what is the fear, बेटा, आपको क्या परेशान कर रहा है? Why you are so not wanting to go to school? What is the reason? Anything wrong in school? What is troubling you? So then the child would tell, and I've seen this in many cases of children where they have pain in stomach and they don't want to go to school. Then they will say, I have not done my homework, or the teacher is very strict, or mama is very strict. Today whenever I have exam, I get this pain, the mama will shout if I get less marks, I'm not prepared. So stomach is the seat of anxiety, it is the seat of fear. Okay, so for Aconite, the mental acts are performed under the influence of anxiety and fear. So his anxiety and fear drive his thoughts, drive his way of thinking, that how he has to lead as per his anxiety and fear. Okay, so that is the meaning of this rubric. So then there is one very important segment of Aconite that I had to highlight. That segment we have done a lot in our Materia Medicas, where there is agony before death, predicts the time of death, death presentiment of, thoughts of death, delusion being doomed, and prophesying predicts the time of death. Okay, उसको मरने का. So these are the acute states where the person believes that he is going to die now. That acute state where he's getting very restless. The situation can be something like arsenic also, where there is also this restlessness, anguish, driving from place to place with restlessness. Okay, so anxiety being beside oneself from anxiety. Then anxiety after fright, anxiety from the pains, anxiety with impeded respiration in hysterical women. So these are the anxieties, and out of which that death is for sure and now I'm going to die, and उनको मालूम है ये ऐसे ही होने वाला है, मैं मरने ही वाला हूँ. And that state, when we give Aconite, it works very well. They want that you give me something, you give me fast, okay, and I should be fine because I know I'm going to die. You have to give me now only. So in that anxiety, in that sensation of death also, they will want to seek light and want to get carried fast. Anxiety, cold, drinks ameliorate. So drink is what na? What is the difference? Means cold food ameliorate क्यों नहीं दिया rubric में? Why cold food is not mentioned in rubric and why drink is mentioned? What is the difference? Because when you have food, when you eat, when you chew, it takes more time for it to go in the stomach. And when you have drink and it goes quickly into the stomach. So your anxiety is settled. Okay, so drink is something. Cold is what? Cold is soothing. When a part is inflamed, when there is an injury, if a cold application is applied, it is soothing. When you are injured, when there is bleeding, so we apply ice. So cold is what? You have any problem, you have any injury, you have any kind of pathology, deepest of pathology, but you just say that you will be fine, don't worry, I'll give you medicine and you will be fine. With that confidence, when the doctor talks, that drink, that is the drink, that goes quickly inside and pacifies the patient. And that is why it is cold drink ameliorates. Okay, so Aconite wants this in any situation, whether fright hai, whether anything. There are so many ailments from now. Fear, anxiety with fear, fright. Okay, so whatever impact, suddenly there is a fear, suddenly the fright comes and it settles in the mind. And that is why, so there is also opium under this rubric. Okay, so Aconite, when it carries the impression of any emotion, any sudden emotion, he will want to be pacified by the light that carried fast. Okay, now opium, when get affected by fright, will carry that fright, will go into guilt that I have done something wrong, or something has gone wrong, and he will try to make amendments. Whatever he does, he will do it agility, mental. He will go in that state where he will perform every minute task very nicely, and but then it won't go into that state of panic like how Aconite goes. Okay, opium is there in painlessness in spite of painful problems. Okay, painlessness of complaints hai. So opium won't exhibit that fear and fright through and through like how Aconite will exhibit. Okay, so this is how Aconite behaves under any, किसी का भी death हो गया, love, disappointment, anything. So you give light, hopeful, alternating with despair, sheep driving, and I think you can prescribe Aconite. And why I'm taking such remedies on YouTube, HHF Rao sir came into my life as a light. Okay, and those, I meet people who say you are very fortunate and you are very lucky to find him in your life. So it is not that who have not met him are not lucky. And this is what I want all the homeopaths to feel fortunate and lucky, because we are a team of homeopaths. HHF is a big team, and we will see to it that his absence is not felt by the homeopaths who have not met him. And whatever we are doing, whatever we are teaching, are all coming from him. And whatever words, maybe every time we are not repeating it, but the base of our knowledge is all coming from Rao sir. So you all are fortunate, you all are lucky, and we all have him around us. This energy is around us. So just be with HHF and follow us on whatever way, in seminar sessions, Telegram, wherever possible, and do like, comment and subscribe the channel so that we can keep doing more new activities in future. Thank you very much. Bye.